New York's largest healthcare provider, Northwell Health, is known for delivering world-class care and innovation. Now they're sharing their vision for the future of AI and patient access, a path towards smarter, more efficient ways of engaging patients. And to learn more, I'm Kerry Jout, joined by Holly Kohler, VP of Patient Access Services, and Peter Howerton, VP of Customer Relationship Management at Northwell Health. Northwell hasn't quite implemented AI in your contact center yet. However, you are exploring how it can improve both operations and the patient experience. So this first question is for both of you. But what prompted Northwell to first begin exploring AI for patient access? Essentially, like, what were the challenges y'all were facing that you wanted to address? And Holly, we'll start with you.
Yeah, thank you. Great question. So obviously AI is where it's at, and we need to be focusing on it. We can't continue to grow our workforce one FTE over another FTE. Our system keeps growing. We just took on a new organization, Nuvance, up in Connecticut. So as we scale and as we grow, we need to keep up with technology to help augment our workforce. In respect to AI, if you think about it, when patients call in and interact with us, they don't always want to talk to someone, although we know in healthcare, many do still, many do. But we also know that we want to put self-service in their hands as well. And we know that AI can be the solution of that. So when they call in, it's AI that can help them just even confirm an appointment. And we're seeing many spaces start with that. And just something like that can really service around 20% of why patients call into us.
Peter, the same question. Like, what have you noticed? What were the challenges that y'all were facing that made you want to explore AI?
As you look at healthcare, we have a lot of disparate systems, a lot of silos, a lot of fragmented data. Through acquisition, through legacy platforms, through emerging platforms, using AI and new technologies is going to allow us to build those connections across. That's how we're going to engage with our patients differently. That's how we're going to enable our providers differently. And most importantly, as we look to the future, integrating our provider and our patient relationships further.
I love that. Holly, are there particular areas within patient access, like, for instance, scheduling or referral management intake, where you specifically see AI making the biggest impact?
Absolutely. You know, one of the challenges we have when it comes to matching a patient to the right physician at the right time with the right reason why the patient is coming in is such a challenge in healthcare. And matching the data to the patient needs and providing that high level of service that they deserve, quite frankly, is really our highest priority. And AI will really help enable that and to be quicker and faster in searching for the data.
Because there's so much information when it comes to patient information. So, like, I can see that monumental impact there. I'd love to know if there are some specific use case examples where AI can make a tangible impact. For instance, how is AI helping automate tasks like appointment scheduling or call routing?
Yeah, well, call routing is really so important and near and dear, right? Running the access center, just having a patient call in and say why they're calling, and then getting that patient matched to the right place within our very large organization is really incredibly important. And so solutioning, not just through AI and self-service, we know just matching that patient to the right area within our large organization is important to achieve that first call resolution.
One of the things, a concern with AI or with automation is losing that human connection. And Peter, like, how are you thinking about striking the right balance between efficiency and empathy?
It's a great question because, you know, one of the things that we don't want to do is lose that human touch. Healthcare is very personalized. We want to make sure that what we're doing with AI and technology allows us to use empathy, human-centered design, and most importantly, get the predictability. Instead of being reactive to what our patients need, reactive to our provider needs, how can we see trends or patterns, and how do we be more, predictive and engaging? So the most important piece is that engagement, not just a transaction-based relationship, but really building that long-term, personalized engagement and making sure we're thinking about empathy and how we connect on a personal level.
I love that. So clearly, y'all have outlined the vision of how AI can be such an impactful addition. What groundwork is Northwell laying to prepare for AI adoption, Peter?
First and foremost, data. We have a lot of data. We got to normalize our data. We got to streamline our data. We had to inventory what data and what integrations are used. As Salesforce and Epic go live later this year, we're going to have a massive amount of data that we've never had before. So organizing that data in a way that is digestible, consumable, and most importantly, actionable having the data there is good, but if we don't have the right data and then the right ideas and rules of engagement, then it's not going to be useful. So we're really taking a strong methodology around data. The second is change management. This is a new muscle. How do we think about this differently? How do we engage our associates to think about leveraging data, integrations, and technology in another way? So really thinking about it from all angles.
I love that. One of the key things you said, though, is actionable, right? Like that data, because so many organizations have so much, and especially in the healthcare industry, you have so much data, but if you can't take action on it, it's not as beneficial. So I love the process that you're outlining here. When you think about a future state, what does success look like when it comes to AI and for your teams, your patients with AI fully integrated? Like, how do you envision success, Holly?
Yeah, this is my dream state, and Dreamforce, right? Dream big.
Yeah.
And so I really haven't seen any other organization embark on the journey that imagine when you're calling in or interacting with Northwell Health, that we know more about you than you remember about your own healthcare needs. So you might be calling just for a well exam, but I also know through the data, to my friend Peter's point over here, through the most important data, I also know you may be overdue for your mammo. Mammograms are really important, a colonoscopy. And so by empowering our team members in the Access Center space to not only book your well exam, but also make sure that you're on track for your colonoscopy and your mammography and knocking out all three to keep our community healthy, it's incredibly powerful.
Powerful, life-saving.
It's life-saving.
Peter, same question to you. Like, how do you measure success? What do you think of success at a future state here?
Highly personalized journeys is one of the key. I think personalized success is our members have a strong trust in our brand. Our providers have a strong trust in the technologies that we give them to do their jobs and make their lives easier. So as I look at the future, our goal is a highly personalized engagement. We have two customers. We have providers and we have patients, and we fuel the relationship from the providers to the patients. So the future looks like, how do we stay highly personalized, engaged in a trusted brand, not just a transaction, really focused on longevity of health, but most importantly, circumstantial. If there's an issue, you got to go to an ER. Being mindful that I'm not sending you outbound marketing campaign to get your colonoscopy because you just got out of the ER. Suppress that type of information so that we really know what you're going through and we're there in time of need.
I love that. And the thing that I would add that I'd love to get y'all's feedback is, like, obviously this is great from an operational standpoint, but what you just said about the impact this could potentially have on patients, when you think about what that could mean for your patients, what comes to your head about that incredible impact?
It makes me want to stay a patient at Northwell Health, right? Imagine a day where we, again, know more about you and your healthcare needs than what you even remember about yourself. The impact on that alone is tremendous. We know that highly personalized care is really where it's at. And so, like Peter said, we don't want to send a message out to you in the wrong time. We know that you were just in one of our facilities, so pacing the right communications is really important.
And essentially, because it's such a sensitive time for your patients. So using that example, if you're getting some sort of marketing email, the way I foresee this and the way y'all are talking about this makes me really feel like the incredible impact that this could have. And I can see on the reactions on your faces, like this smile, because it truly is better for all parties involved. Thank you so much, Holly, Peter, for sharing your insights and forward-looking perspective on how AI can elevate patient access. To learn more about how Agentforce for Health and Life Sciences can enhance patient, provider, member, and customer experiences, scan the QR code on your screen or visit sfdc.co/AgentforceHLS guide.